Finding a new lump or bump on your body can be a worrying experience. Before you let your mind race ahead, please take a deep breath. The purpose of this discussion is to provide clear, calm, and practical information. We want to help you understand what might be happening, what you can do, when it is wise to seek professional help. Many people discover a swollen lymph node at some point in their lives. You might find one while washing your face, shaving, or simply feeling a tender spot under your jaw. These small, bean-shaped structures are a normal part of your body's defense system. When they swell, it is most often a sign that your body is doing exactly what it is supposed to do, fighting off an infection or responding to an irritation. It is a signal, not necessarily an alarm. This talk will walk you through the basics of the lymphatic system in simple terms. We will break down complex medical ideas into simple, understandable pieces. There will be no confusing jargon here. We will focus on what you need to know right now: what lymph nodes are, why they swell, what simple home care measures you can take, and when it is time to see your doctor. Feeling a swollen node is common, especially in children whose immune systems are learning. Your body is remarkable and resilient, and understanding its signals is the first step. So, what exactly are these lymph nodes? Imagine them as small, intelligent security stations scattered throughout your body. They are soft, bean-shaped glands, and you have hundreds of them. Most are too small and deep to ever feel. However, some clusters sit closer to the surface. You can often feel them along the sides of your neck, under your chin, in your armpits, and in the groin. Each lymph node is part of a larger network called the lymphatic system. It functions like a filtration and drainage system. Think of it as a parallel circulatory system, carrying a clear fluid called lymph. This fluid bathes your tissues, collecting waste products, excess fluid, bacteria, viruses, and other foreign materials. The lymph then travels through a web of tiny vessels on its way to be cleaned and returned to your bloodstream. Inside each lymph node is a hive of activity packed with specialized immune cells, lymphocytes. As lymph flows slowly through, these cells act like inspectors, scanning for anything that should not be there. If they detect harmful invaders, bacteria, viruses, or abnormal cells, they spring into action to neutralize the threat. They are your body's first line of defense, rapidly producing more warrior cells to mount an effective attack. That cell surge, plus trapped germs and inflammation, causes the node to increase in size. This swelling, called lymphadenopathy, is a tangible sign that your immune system is working for you, right? That's what's happening. Let's look at why nodes swell and what you can do. The vast majority of swollen lymph nodes are caused by common minor infections. Your body is constantly exposed to viruses and bacteria, and your lymphatic system is always on guard. When you catch a common cold or the flu, the lymph nodes in your neck can enlarge and become tender. A sore throat, an ear infection, or an infected tooth can each cause nearby nodes to swell. Skin infections, a cut that gets infected, a boil, or a severe insect bite, can trigger swelling in regional nodes. Athlete's foot can lead to a swollen node in the groin. Once the primary infection is treated and resolves, the node usually returns to normal size. Some vaccinations can cause temporary swelling. After a shot in the arm, you might notice a tender lump in the armpit on the same side. Less commonly, autoimmune disorders like lupus or rheumatoid arthritis can cause generalized swelling. Very rarely, persistent swelling can signal a more serious condition, including cancer. But this is the exception, not the rule. If you discover a swollen lymph node and you have symptoms of a common illness, like a cold or a sore throat, the first step is not to panic. In most cases, supportive care at home is enough. Apply a warm, not hot compress over the swollen node for 10 to 15 minutes, several times a day. Stay well hydrated, especially with water, to keep lymph flowing. Eat small, nutrient-dense meals. Avoid poking or squeezing. Use acetaminophen or ibuprofen as directed if you have pain or fever. While most swollen lymph nodes resolve on their own, there are signs that should prompt you to see a doctor. Create a simple mental checklist. If a lymph node stays swollen for more than 2 to 3 weeks, get it evaluated. A very hard or immovable node is more concerning. A slightly rubbery, movable node is more reassuring. Watch for systemic symptoms, unexplained fever, drenching night sweats, or significant unintentional weight loss. If swollen nodes occur with these symptoms, do not delay seeking medical advice. Rapid growth over days or weeks or swelling just above the collarbone should be evaluated. Redness, streaking, or warmth over the node could mean a direct infection that needs treatment. When you visit your doctor for a swollen lymph node, the process is systematic and thorough, but not frightening. They will ask when you noticed it, how it changed, whether it is painful, any recent illnesses, infections, injuries, travel, animal scratches, fever, fatigue, or weight loss. Next comes the physical exam, assessing size, texture, consistency, and mobility, and checking neck, armpits, and groin. They will examine your throat, ears, skin, listen to your heart and lungs, and feel your abdomen for spleen or liver enlargement. Based on findings, tests may include blood work, often a complete blood count, and an ultrasound to characterize the node. If the node remains suspicious, a biopsy, needle sample, or removal can provide a definitive diagnosis. Each step is a logical path to answers. Your doctor is your partner. Ask questions and seek clarity. Did you find this video helpful? Please hit the like button and share it with your friend to spread the word. If you haven't subscribed yet, subscribe now so you do not miss any new video.